This section is going to be all about the immediate recovery after having a vaginal birth. So what we want to do as physiotherapists is make sure we start by improving your comfort, getting you up and about and moving after having your vaginal birth, and looking at starting to engage your pelvic floor muscles and your tummy muscles. One of the big issues after having a vaginal birth is around tearing. And sometimes people need an episiotomy in order to have their baby via vaginal birth. Now, as physiotherapists, we tend to recommend the process called RICE. And RICE stands for rest, ice, compression, and exercise. Now, with rest, what we want to do is make sure that we're giving that wound time to heal. That involves making sure whenever possible, when baby's sleeping, that we're also lying down. Having too much pressure downwards over that area is not going to help with the healing process completely. Obviously, there will be times where we have to sit, so we have to make sure we're finding the most comfortable positions. But wherever possible, have a lie down and allow that wound to heal. With ice, it's obviously quite difficult to pop a pack of ice down there. One of the key things that we tend to suggest is you can get a maternity pad, fill it with water and pop it in the freezer, and you can store a couple in there as well. When you're ready to use that, pop that in, and that provides a natural soothing healing effect for any stinging wounds or any sort of sensation that's unpleasant for you. Now, with compression, we also want to make sure that you're wearing appropriate underwear. You want nice big pants to make sure that you're keeping yourselves supported. And we do recommend a maternity pad, something a bit thicker than a normal sanitary pad, just to make sure that you're getting that compression there. Finally, the biggie, exercise. It's never too soon to start engaging the pelvic floor, all right? So what we want to do is whenever possible, when you're lying down and resting, just start to think about engaging that pelvic floor. We're going to go through some of those exercises later on in the session so we can guide you through how you do that. Now, with any tears or any episiotomies, once wound healing has completed, around 6 weeks, we may find that it feels a little bit tight down there. And that can often be because of scar tissue that's formed. Now, like with any other scar tissue and any other wound in the body, what we want to do is make sure that we're relieving that tension. And the best way to do that is through a little bit of massage. You may or may not have completed any perineal massage prior to having a baby in preparation. And if you haven't, now's the time to get to know down there. So what we tend to suggest is popping your thumb down between where your vagina starts and your back passage and just providing a small circular motion, either using moisturizer or bio oil. And just slowly apply a bit of pressure just to make sure that we're breaking down any of that scar tissue that's causing too much tightness. You might have to play with this a few times just to find the most comfortable position, but it will really help as we start to progress you further with other things such as exercise and when we're thinking about toileting. Some of the key exercises that we start with, especially when you're in hospital, are things like getting in and out of the bed, how you lift your baby, how you sit and feed your baby for the most comfortable position for you and for baby, and also any swelling management after having your baby. So, the first one is getting in and out of the bed. You may find it's extremely difficult for you to just sit up as you used to. And this is because our tummy muscles have expanded during pregnancy, and they're a lot weaker than they used to be. As we allow those to heal, we want to make sure that we're giving ourselves the best possible opportunity to rest, but also start to engage those muscles. So, the best way to get in and out of a bed, on your back, you would lie and then roll in one movement to the side. Once you're lying on your side, we want you to bring your knees and legs over the edge of the bed and then use both hands to come up to sitting. If you're looking to lie back down, we would do exactly the same movement, but in reverse. This is to stop any excess pressure on your belly. We don't want to be sitting straight up. We don't want to be doing too much twisting and turning. Lifting your baby. Often, lots of new mothers will experience some back pain, and especially when we're having to lift our baby in and out of a cot or Moses basket. So, what we want to do is make sure we're starting to engage our tummy muscles because they're the corset of the body and they are going to protect our back from overworking. In order to do this, the best way to pick up your baby is to really think about, one, engaging your pelvic floor, bending your knees, and not leaning over from the top, but thinking about getting down to a level and bringing baby up. Sitting and feeding your baby will be something you do a lot in the initial stage, whether that's breastfeeding or bottle feeding. And we want to make sure you're comfortable as you're feeding your baby. Make sure you're sat upright, and you can have some pillows behind your back to make sure that you're sitting in a nice comfortable position and that you've got back support. We would also recommend lots of pillows just to keep your arms nice and supported so that they're not having to do all the work. If we're having to work too hard with the arms, we often take much of that strain in our back and we end up getting a bit of back pain. Finally, swelling management. You might find that you've still got those puffy ankles and puffy face and puffy fingers after having your baby. So what we want to do is start to ease that swelling. Walking is one of the best ways to get all our swelling draining back into the lymphatic system. Things like ankle pumps, so circling the ankle and pointing and flexing the ankle, can really help with swelling that occurs at the bottom of the legs. We try and say, when possible, lie down. This is going to also help with your swelling management. It's really important that we give ourselves the time to recover after having a vaginal birth. And although you may be busy with your baby, it's really important that when you've got the opportunity that you are starting to work your body, but also rest it appropriately.